Okay, welcome back, and we are going to continue our presentation on mental illness and how it specifically impacts women in today's society. So compared to men, women are more likely to have all of these mental illnesses and in significantly greater numbers. As you can see, depression 2 times as much. Part of that can also be attributed to gender roles that have not changed too much in society, to where women we're still working. We're working now. We're taking care of children, and we're still taking care of the home. So that can be part of it. Depression can also be brought about by the work environment, sexual harassment. The Me Too movement is really blowing up now, and a variety of different factors. I mean, it just is endless. And then seasonal affective disorder. This is something that you might notice depending on how the weather is. People tend to be more jovial when it is pleasant outside. This is one of the primary reasons why I could not live on the East Coast. I used to live in Washington, D.C. I used to teach in Southeast Washington, D.C. I lived in Alabama for multiple years. And let me tell y'all, it's too cold. My heater right now is on 80 degrees. And so I cannot really function in cold weather. I get a nasty attitude. I don't want to come into work. I feel a cough brewing now just thinking about cold weather. I'm just not really compatible with too much precipitation. And so this is something that actually does impact people's moods. I'm in a much better mood when it's nice outside, when I don't have to bundle up. I don't have to worry about catching some sort of deadly disease or Ebola floating around when it's -5 degrees outside. So I don't like cold weather. And this is something that also impacts women significantly more than it impacts men. Then we come to anorexia and bulimia. And this is one of the sadder statistics, where it impacts women almost 10 times as much as men. Part of this is due to ridiculous standards of beauty that pretty much 5% of the population falls into, and that is a completely arbitrary number. But take the theory, or take the spirit of the message, and very few people look like the individuals on the cover of magazines. As a matter of fact, the people on the cover of the magazines don't look like that. That is called airbrushing. That is called photo finish. That is called thousands of dollars of Smashbox and Max Cosmetics, and a variety of other things that we don't have access to. Photography, well-lit buildings, well-lit atmospheres that make us look amazing. And so because of these unrealistic standpoints, it's not surprising that bulimia and anorexia, which manifest themselves in a physical form, but they actually are psychological disorders that just have a different manifestation. Phobias, panic disorders, approximately 2.5 times as much as men. Borderline histrionic personality disorder. Women are less likely to have schizophrenia. So we came in on top of that one. Antisocial personality disorder, attention deficit disorder. I know a lot of women that have ADD, but I also know a lot of men who have it, or be violent as a result. So we do have some good things coming our way, ladies. Women don't tend to lash out violently or as abruptly as men do when they suffer from these same treatments. Some of this is stigmatized or thought of to be that women are more likely to receive help. Women are more likely to stay on their medications. Women are more likely to not necessarily have an internal stigma about going in. They may be embarrassed about it, but they may want to help themselves more. So these are all suppositions. These are all unproved facts that kind of rationale as to why women do not have some of these diseases in as high as quantity, or they don't lash out and be violent, such as many men do in the litany of public shootings just this year alone, 2018. We can see that some of these people, yes, they suffer from mental disorders. Some are flat out racist, so we're not going to merge them into the mental illness category. But yes, we notice that not really women lashing out violently and committing mass murders when they have mental illnesses. Not to say that they don't have it, but the reactions are just not as traumatic as a whole on society from a physical death, gore, violent point of view. So now we continue to look at some of the costs associated with mental illness, and it is a lot. Look at how many vets are at the veteran centers or the VA hospital. This is something that even if you were not directly involved with the war, if you are treating people who came back with these traumatic injuries from combat, that can have a psychological pull on individuals. So we do have to consider that as well. That's a huge cost analysis that VA hospitals and Medicare, that they all have to kind of factor in these huge costs of treating mental disorders. It's magnificently huge. And you may have noticed that there are people on the street who have these mental illnesses. And so we can walk past them and wonder why they're talking to themselves and wonder why they're doing this, wondering why they act this way. And many of them do suffer from mental illnesses. The women are more likely to be abused on the street, and so it's kind of more violent for us to get out there. And that, may help with why women tend to not have as much of a fallback or a barrier to getting treatment as men do. So some of the economic burdens, we need for mental health services to really be prevalent. We have a Center for Health here on Pierce College's campus, and you can actually go in and have several sessions for free. I tell people this all the time. Nobody knows. Nobody takes advantage of it. You can go in there and talk to somebody for free. You get multiple sessions. I want to say it's at least half a dozen sessions. But you can go and walk up in there, and these are people who are trained in this field. Most of them are getting their PhDs or doctorates in psychology. These could be wonderful aspects of or resources for you to use, particularly when it comes time to finals and midterm, things of that nature. Additionally, we look at unemployment, reduced productivity. Come on, people that are not feeling well are not going to produce as well. And when you do that, it's not just a numbers game, it's also productivity, because productivity equals money. And at the end of the day, time is money. You can always make more money, but you can't get your time back, which kind of means that you can't make as much money if you're not being productive with your time. So that's a huge economic burden that companies and organizations face. Financial burdens on families. I mean, come on. This is just a huge one, especially with the cost of living now in the United States. We live in the greater Los Angeles area. It's extremely expensive. Can you imagine, on top of all of that, now having to add on the cost of mental illness and all of the things that it entails? Extra daycare, extra medicine, extra gas money to get there, the cost of the prescription, the co-payments. It's expensive. Increased levels of crime and threat to public safety. We've seen that. I'm not even going to start counting the number of shootings this year, but it's been a lot. And then the negative effects of premature mortality. So we have an expected life range that we're supposed to get close to or hit or possibly exceed. Premature mortality is anyone who dies earlier than they should. Not someone who has a genetic disease, but someone who, because of mental illness, they may develop unhealthy habits that really do not fare well on the cardiovascular system, on the lymphatic system, on a variety of systems, and this way they actually do the opposite of prolonging their life. They're actually cutting their life short. Now we look at some of our legal dimensions. Let me fix that on up for you. All right, there we go. And so some of our legal dimensions, we look at the mental illness crime paradox. And what we see here is that given treatment, people who consistently go in for treatment, and this is extremely important, people who get treatment and stay with it are not any more likely to commit crimes than the general public. So we're looking at untreated mental illness that is responsible, particularly in men, that is responsible for these violent outbursts, these violent displays that often result in death. But given treatment, they normalize just like anybody else. Okay? Kind of think about how you feel when you're very hungry and then you turn angry. There's a phrase for that. We call it hangry. Once you get something to eat, you're a much nicer individual. Some people are like that in the morning when it comes to coffee. You may not speak to them before they have had their cup of coffee, then they have their cup of coffee. Now you may speak. Okay, they're regular human beings when they get their coffee. You're a regular human being when you eat. Well, these people also are regular human beings, and when they have treatment, they're perfectly fine. They're perfectly fine. No, we all have examples of individuals who have gone off their meds, and it's a little noticeable, sometimes more noticeable than others, but given treatment, they're not going to hurt y'all. Without treatment, these things escalate so much. They are more likely to commit crimes, become arrested, have negative outcomes when it comes to the court system. And we know that police officers and military personnel are not necessarily trained in dealing with those who are mentally ill or handicapped or require assistance with the ADD, or most minorities. So these are things that we really must consider when we look at legal dimensions, because it is a violation of certain human rights laws when you are not treated in accordance with your mental illness. And part of that is because having a diagnosis. So it's important to be diagnosed so that you can then draw from the benefits and the protections of the Americans with Disabilities Act, because mental health is a protected clause, is a protected category for health. So your boss can't tell you no. If you're grieving and you're going through something that is affecting you psychologically, they cannot tell you no, you cannot have those days off. You are federally protected. It is a federally protected class. Okay, moving on. There we go. Clinical dimensions of mental health. Okay. There are a variety of mood disorders, and we're just going to list them all here. Depression being the most common. These kind of involve a prolonged sense of just sadness, of gloom, apathy, low energy, just not feeling up to do anything. You may no longer take joy in the activities that you once participated in large amounts. And then you have bipolar disorder. And this is kind of, two separate ends of the scale there. This involves mood swings from mania to depression, back and forth, everything in between. So you can be happy one day and then the next day you're upset. You can be sad one day and the next day you're happy, or it can happen in the same day. These are things, these are mood disorders that they're actually fairly common in the mental health community, and there's quite a few treatments that can allow you to really thrive, even though you have these types of disabilities, these types of mental illnesses. Depression is by far the most common. I mean, many Americans suffer from depression. So many of them. And it's really sad because depression is treatable. It's treatable with medication, psychotherapy. You got to find someone that knows what they're doing, not just someone who says, I can treat this, someone who is certified, someone who is a legitimate psychotherapy expert, or combine both of them. It's very common to treat depression with these things. And the left side in table 12.1 is just going to give you some of the common side effects and symptoms. Very sad, gloom and doom, excessive crying, low energy, just fatigue, malaise. You may lose weight on depression if you have depression, and you may gain weight if you have depression. It just manifests itself differently in different people. And so it's something that a large number of Americans and women suffer with, and it's extremely treatable. When we come to bipolar, we talked about that a little bit before, kind of lows and highs. You're one, sun rises, you're here, sun sets, you're there. So the highs are feeling just amazing, euphoric, celestial, well energized. You are just floating on cloud nine. However, you're easily irritated. That's a common thing for me. I don't have any patience. I'm always irritated. So one of these things in and of itself is not indicative, but a combination are. And then the lows, deep, persistent feelings of sadness, anxiety, hopelessness, guilt. You don't enjoy things anymore. You have suicide thoughts, lower sex drive. You just don't feel like doing nothing. Very common. So we will continue with some of the other disorders on part 3.